Good afternoon, everyone. I know this is always a tough time slot right after lunch, but I am sure that we are going to be really engaged in this next session. My name is Nicole Dowling. I am at the Centers for Disease Control, where I am an epidemiologist and work for the Division of Cancer Prevention and Control as the Associate Director for Science. And it's an honor to be here today. I wanted to thank the meeting co-chairs and the National Cancer Policy Forum for inviting me to moderate this session. I'm also a member of the National Cancer Policy Forum, so I'm familiar with the great work that all of us here do towards cancer policy. So we have 5 speakers in this session, and then we have a special presentation that will kick off our panel session. So I don't want to talk too long because I want to be sure we have enough time for all of our presentations. But just briefly, in this session, we are going to dive deeply and broadly into topics of communication strategies to build public trust and counter inaccurate information about cancer. And just briefly, our speakers will address a number of topics, including overcoming the challenge of online health misinformation in cancer communication, opportunities for local and state governments to promote effective public health communication about cancer, strategies to convey accurate and accessible cancer information to the public, 21st century media strategies to engage and inform the public about cancer, and ensuring responsible media communication about cancer and strategies to build public trust. So I'll invite each speaker up individually right before your presentation and give each of you a little bit of an intro. So without further ado, I'd like to introduce our first speaker, who is Dr. Sylvia Chou. Dr. Chou is a program director in the Health Communication and Informatics Research Branch of the Behavioral Research Program at the National Cancer Institute. Her research interests include social media and health-related misinformation online, health literacy, patient-provider communication at the end of life, and mixed methods research. Dr. Chou has led a number of important efforts at NIH on the role of technology and social media in various areas of health, including funding initiatives on the impact of the changing communication landscape on substance abuse and addiction, as well as cancer prevention and control. So it is my pleasure to welcome Dr. Chou, who will be our first speaker today.
Well, thank you. It's a pleasure to be here and to discuss a lot of the emerging issues facing cancer communication. I do a lot of different my work and my portfolio of funded research has focused on a lot of different aspects of the cancer control continuum. But today I'm going to focus on the role social media has played in the way we need to think about how to do and deal with the issues that has surfaced as people's growing use of online communication. So let me make sure this is the right. How many of you have seen the Washington Post and the Wall Street Journal article in the last few weeks on misinformation on cancer? So the Wall Street paper, a study that's referenced on the lower right corner, uncovered so much false and misleading information about cancer and cancer treatment, snake oil, cures. That's very prevalent on YouTube, on Facebook, and now it's prompting these industry, partners and technology companies to think about how to combat this issue. And this is not new, but I think one can say it's gotten to a point where we really can't think about health literacy and think about how we do cancer communication without thinking about these things. And a few of the key drivers that I see as reasons why this is becoming more prevalent and impactful, getting people to share misinformation with one another is a few things. There's a viral sense that information can spread quickly and rapidly, and that we're in siloed. Our social media tend to be areas, people, and places that we trust, right? So I am not in certain silos that other people who say, for example, the vaccine skeptics, vaccine hesitant people are living and working in, right? So I'm not getting to be exposed to these things. Also, with cancer, there is an inherent sense of vulnerability and the need for hope and optimism. And I think that is something to really realize that there's a reason people are going to hear something that they wish they could hear from their doctors. And that also comes to the fact that we are at a point of historic low trust in expert systems, including providers. So that comes to why I think I think it's an important health literacy concern, because limited health literacy communities and individuals are potentially at greater risk of being affected by misinformation. So if we think about cancer communication, we now have growing amount of inaccurate or false information. We also see most people going to online sources as their primary source of information, including health-related information. There's a declining trust in social institutions, including the medical systems and even scientific expertise. While we're trying to do all the good work of disseminating evidence-based cancer information, whether it's about treatment, about prevention, we also have to think about the same message that we're giving may be countered by false information about the same topic. Think about we're trying to promote HPV vaccine. Here we also get all these people saying vaccines are not to be had. So how do we think about disseminating evidence-based while addressing misinformation? And why we need health communication science. And I think this is some of the reasons. We need to think about the timing of communication, the channels and platforms, the way we do targeting and tailoring, as well as different science and health literacy or even technology literacy considerations. How do we build trust? I've heard that theme coming up, trust and trustworthiness. And that requires more than scholars and clinicians and healthcare systems, but we need to think about other partners, including the technology platforms and industry and social scientists. I was asked by my panel to sort of share one of the definitions that, as part of a working group that I had the pleasure of leading, coming up with for definition for health misinformation. And this is published in JAMA in last December. Health-related claim of fact that's currently false due to the lack of scientific evidence. We took a long time to come up with something that's pithy and generally true. However, if you think about it, there are a lot of things that don't fit in this definition that also have problems, right? So whether it's the intent of spreading misinformation without saying so, or the context, thinking about all those anthropologists and linguists here, I think there's so much work to be done thinking about context. And you can have a claim of fact that's not false, but have equally negative impact for health, as well as so much of online information is using images and visuals and videos and memes. Try to ascertain that a meme is false. It's nearly impossible. So I think we need to think about other types of misinformation that may not fit the definition. I want to just step back for a second and say, why is social media a focus for us when we deal with cancer-related misinformation? I think every benefit of social media also comes with its risk. So we see so much good interventions, especially patient support groups, leveraging social support that can be available online. You're meeting people who are, we even heard this morning, right? You're meeting survivors and patients who are going through the same experience as you. And that's something so different than just your regular network. So affording social support. But on the flip side, when you're anonymized behind the screen, it's easier to engage in cyber aggression. And one of my research projects a few years ago really successfully demonstrated so much weight stigma and even misogyny that's online related to weight-based bias, and that's very rampant on social media. All the communication experts here know about the power of targeting and tailoring, but that is also at the time we have so much information silos and echo chambers. The people who do health disparities work have lauded online and social media as a great opportunity to overcome some of the disparities because we can reach people where they live, work, play, and pray, right? Where they're on Facebook, we can give them messages at the right time. But if you're in a community that's of limited health literacy, it's more likely that you may believe in things that probably wouldn't help you, wouldn't benefit your health. Timing is a big part of social media. It allows for real-time outreach and engagement, but it also allows for real-time spread of anecdotes and falsehoods. Peer-to-peer interactions is great because then you can meet with people who share your experience, but without expert gatekeeping, you may be sharing information that's not helpful. Someone say, I didn't follow my doctor's advice. I went for this baking soda injection, which was actually in the Wall Street Journal, as a cancer cure. Because that person had a good experience, I went and followed that. That could be very, very lethal consequences. Low-cost intervention. Social media is much cheaper. When we see some data on marketing, if you just look at expenditure data, I think it doesn't even tell you the efficacy and potential reach of these kind of cheap interventions. But cheap can also mean it's cheap to spread bad information. So we see misinformation in the areas of all different spheres of life, from political discussions to climate change to other areas of our society, but health is not immune to that. We see this in vaccine debates, as well as many other topics. In terms of cancer, besides HPV vaccine, we also see sun safety information, and cancer cures, cancer prevention techniques, different ways people have mentioned ways to combat their diagnosis. But I think the one paper that really helped me understand a little better, we don't just chase after bad information. We need to think about the drivers, sort of what's actually motivating and making these misinformation communication so effective. This paper by David Bronialkowski looked at anti-vaccine sentiments on Twitter and find that so much of it is perpetuated by bots and trolls, and with the goal of dividing us, with the goal of authenticating or legitimizing a debate when there wasn't one. It's a settled science. Vaccine is settled science. However, by promoting both pro and anti-vaccine related sentiment and discussion, it makes it seem like there is a real debate, right? And that erodes public trust that there is a consensus. And I think this is very important to think about when we consider health literacy, because vaccine-hesitant parents are more likely to turn to the internet for information and less likely to trust their providers and public health experts. So exposure to vaccine debate may suggest that there is no scientific consensus and therefore shaking public confidence and trust in vaccination. So why do I reference that case example? Because I think the way we need to combat health-related misinformation need to be very multi-pronged and very innovative. And if I can only have one slide, I think this would be the one where I am putting forward where I see to be the priorities. First, we need to focus on real consequences. We need to think about not just chasing after misinformation, but the exposure to misinformation that is consequential to behavior change and health outcomes. And think about what threshold of exposure becomes a meaningful, exposure. Secondly, we need to improve our health communication and health literacy surveillance efforts. We need to think about information poor, information poverty communities. We need to think about bubbles and opportunities for penetrating these bubbles. We need to do a better job at collecting longitudinal and spatial and network information. And we need to think about not just explicit forms of misinformation, but implied and implicit. Thirdly, we need to do more awareness raising and education. How do we create and sustain trust? And I was very happy to hear that was discussed already. We can't just think if we give people information, the NCI or the CDC or the Mayo Clinic, people will necessarily take it up. They have to have some level of trust with the source of the information. How do we leverage trusted influencers? People trust other people, right? How do we find the people that our intended target audience trusts and leverage those people, whether it's through media, mass media, celebrity, church-based, faith-based organizations, or different ways to find the trusted influencers? How do we foster scientific literacy generally? And this is not just at the point of a cancer diagnosis, but for us as a society. And at what point do we do that? Is it going to involve schools and education institutions? And lastly, when we do intervention development, and here I'm not talking about health intervention generally, I'm talking about interventions that combat misinformation, we need to think about how to address and mitigate misinformation. Sometimes corrections work and sometimes corrections backfire. So when to correct and how do we determine the point for correction? And to do that requires a lot of consideration of issues of identity, emotions, and values. So the second paper there, led by Southwell et al., was a nice synthesis of a working group meeting that was convened last August that's looking at how misinformation has been a misunderstood challenge in public health, and I encourage you to take a look at that. And I'm going to use 30 seconds to share a case example of why I think we need to look at context and process. This is a study that a few of my colleagues here and I have worked on together that's using eye tracking and mixed methods design to look at how people process different kinds of cancer information. We want to look at the actual attention spent on the message and their idea of what's trustworthy and what is not, and the credibility that people attribute to different sources. So we basically brought participants in to a lab, and then we randomized stimuli to different types of information. We gathered their eye tracking data. We also asked them to fill out a survey at the end, and then we do a debriefing and cognitive interview. So no one is left thinking that vaccine is unsafe, for example. We gave them the stimuli by looking at these 4 characteristics. Is it narrative-based? Is it non-narrative? Is the message coming from an organization or from an individual, like, a Facebook friend? Whether it's evidence-based or not, and these 2 topics. And this is what it looks like when we get at the thing called AOI, areas of interest. Where are their eyes gazing, focused on? And we can measure the length of their time spent on these things. Some of the preliminary findings, source definitely matters. People pay a lot of attention to that Facebook. Oh, I should have said it's a simulated Facebook post. So people are looking at where that message is coming from. There seem to be more reported trust of government agencies than individuals. Though we don't see really any difference in terms of government organization and bogus health organizations. When they're looking at non-credible messages, they seem to trust these bogus, organizations more than an individual. So what I take to as an implication is we need to think about the role of illegitimate organizations masquerading as credible source of information, because we know where we work, we know the data we have is credible, but when we're communicating to the general public, National Cancer Federation, you can make up words that sound very official, and most people probably can't distinguish. So I think that's an important reminder. And the role of health literacy, and we're doing a number of studies looking just at how health literacy plays a role in how vulnerable people are to misinformation. So currently, we have 2 initiatives. One is a funding opportunity that I encourage you to look at that's looking at innovative approaches to studying cancer communication. And the other one is a special issue in the American Journal of Public Health that's looking at health misinformation. I really encourage you to look at it because the proposal deadline is August 31st, so you still have time to work with your team to think about if you can contribute to that. And in closing, I will say, even though there is so much research to be done, I think there are some tangible opportunities for healthcare organizations as well as community partners and communication practitioners to be already engaged in, such as monitoring bots and trolls and leveraging trusted brands and then doing media literacy training. So thank you. I look forward to more discussion.